For this St. Louis family, Thanksgiving will look different this year.
No family gatherings, no cooking, everything has changed.
It's been 7 months since Jasmine Whitfield's mom, Cynthia, passed away from COVID-19.
She took every precaution not to get sick, and she still got sick.
As healthcare workers, Jasmine and her mom both knew the safety measures needed to keep both them and their patients safe.
She went and bought her own mask because they weren't provided by the job.
Cynthia worked at Grand Manor Nursing and Rehabilitation in St. Louis's Grand Center. Jasmine blames the facility for her mom's death.
Did they have lives on their hands?
Cynthia tested positive for COVID in April.
Achy body, chills, fever, like having all these symptoms.
One thing she didn't have, paid time off.
She did not want to go to work. She asked could she be off. She wasn't feeling good. They allowed her to take the next day off.
Less than 24 hours after returning to work, Cynthia was hospitalized.
Sunday, I was called to her place of employment saying that she wasn't able to work, that she couldn't keep her head up.
1 week later, Cynthia Whitfield was dead.
That you're just waiting for people just to steady die. That's honestly what I think.
According to federal data, 9 residents and 6 workers at Grand Manor tested positive for COVID between May and October. That doesn't include Cynthia's case.
That is crazy. Why do you want people who are still testing positive to come into a facility where there are patients and residents who have tremendous underlying health issues?
Lenny Jones is the Missouri director for SEIU Healthcare, a union for healthcare workers in the Midwest. He says the union has been fighting for PPE for its members since the pandemic began.
Many times it's not about what is in the best health outcomes for workers or for residents. It's about, making money.
Jones says some healthcare workers have turned to the Occupational Safety and Health Administration, or OSHA, to report unsafe work conditions.
So it's very difficult to even get them in to kind of investigate. If they are fearful of going in and not even wanting to do an investigation, how do the workers feel? Right? Who's got their back in this situation?
The I-Team looked at the numbers. Since March, OSHA has closed 51 COVID-19 related complaints from workers in area nursing homes, hospitals, and doctors' offices in both Missouri and Illinois. Topping the list of complaints, SSM Health St. Mary's Hospital, where one of their 4 complaints said the death of a St. Mary's nurse was not being investigated. And a Lutheran Senior Services site called Mason Point, where one staff member reported a coworker was on the job with symptoms. OSHA has opened investigations into another Lutheran Senior Services facility called the Merrimack Bluffs. It's facing fines as high as $13,000 after a worker died of COVID-19. In that case, Lutheran is contesting OSHA's findings. Facilities in Glen Carbon and Carlisle, Illinois are also currently under OSHA investigation. And so is Grand Manor, where Cynthia worked when she died.
What's always been the problem is OSHA, even when they find fault, their fines are so little that employers don't take it seriously.
If no one steps in, if they're not fined, how do you know? Oh, they're not taking it serious neither. Something has to be done.
Almost a month after her mom died, Jasmine got the devastating news that her grandmother had also passed away from COVID. For Jasmine, holiday traditions will never be the same.
So it's just hard to lose both of them at one time.
The administrator at Grand Manor told me they had no idea Cynthia had a COVID test. They say she was sent home when she started having symptoms, and they also say they believe she had accrued time off, but they couldn't confirm that. We do know since her passing, Grand Manor has instituted mandatory temperature and symptom checks for all employees entering the building. We have statements from many of the facilities mentioned in our story on our website, KSDK.com. For the I-Team, PJ Randhawa, 5 on your side.